Hello students, in this video you are going to learn about a serious sexually transmitted disease called syphilis. Please like, subscribe and share my videos. Syphilis, which is also known as leus, is a serious contagious venereal disease or STD. First, we learn about the etiology of syphilis. Etiology means cause and origin of the disease. So, in this, usually we study about the causative organism. And the causative organism for syphilis is a bacteria. The name of the bacteria is Treponema pallidum. So, the causative organism is Treponema pallidum. It is a spiral shaped bacterium. Spiral means it is just look like spring. It is having the structure of spring. It is 6 to 8 micron in length, 0.2 micron in diameter with tapering ends. The body is coiled in 8 to 15 regular, rigid, sharp spirals. It is actively motile, showing rotation, backward and forward movements. Usually these bacteria do not take any stain properly. Hence, it can be seen better under dark ground illumination. So, the shape and motility of the bacteria can be studied well by using dark ground microscopy technique. In this picture, you can clearly see the bacteria Treponema pallidum which causes syphilis under dark ground microscope. So here you can observe the shape of the bacteria. Because of that, light illuminates these bacteria against the dark background. Now come to the mode of infection or how the disease spreads. See, for all sexually transmitted diseases, the mode of infection is almost similar. So quickly we have discussed mode of infection in the case of gonorrhea also. So quickly here we discuss the mode of infection. So the important mode of infections are: it is transmitted during sexual intercourse. It can also be transmitted to the fetus of an infected mother through placenta. The incubation period is 10 to 90 days. Symptoms of syphilis. There are 3 stages in syphilis. It means the disease syphilis occurs in 3 different stages, and the symptoms for these stages are different. The 3 stages are the primary stage or first stage. Number 2, the secondary stage, which is also known as second stage. And the third one is tertiary stage or third stage. The primary stage usually appears in 15 to 30 days after the first infection. Once the organism enters into the body, after 15 to 30 days, the symptoms appear. These symptoms include presence of chancre. Chancres are nothing but painless hard ulcers or lesions. Usually they are present in the genital areas, either on the penis or vagina. The chancre is highly infectious. It means it easily can be passed during sexual intercourse. The disease easily can be passed to the partner because as the chancres are highly infectious. The regional lymph nodes are swollen, rubbery and non-tender. This is the another symptoms. The regional lymph nodes in the genital areas are usually swollen, they become rubbery and they become hard. They are not soft. They will not remain soft. Chancre heals up into 40 days leaving thin scars. So usually this period either you undergo treatment or not, usually they heal within 10 to 40 days leaving thin scars. The secondary stage of syphilis. It occurs in 2 to 6 months after primary stage. Rashes appear all over the body and also in the mouth. Sores also develop in the mouth and genitals. Sores means painful red patches. They appear almost in mouth and genital areas. Adenitis. Adenitis means inflammation of the glands in the genital region. Warty growths in the anogenital region appear. This condition is called condylomata. Warty growths means nothing but hard and rough growths will be there on the skin in the genital areas. This condition is referred as condylomata. Patient is highly infectious during this stage. Even if the disease is not treated, the symptoms may disappear temporarily, but the bacteria and the disease remain latent in the patient to reappear with severe disorders in third stage after few years. So even though without treatments also the symptoms disappear, but after some time, usually after some years, the third stage of the disease appears if it is not treated properly. The tertiary stage or third stage, it is also known as late syphilis. This stage appears 1 to 30 years after the latent stage. During this stage, the disease comes back with serious disorders affecting various parts of the body. The following disorders or symptoms are observed. Number 1, gummas. Gummas are nothing but rubbery tumors which appear on the skin and also internal organs. Aneurysm. It is nothing but abnormal weakening of the walls of the arteries which leads to angina pectoris. Angina pectoris means chest pain. Paresis or partial paralysis due to the nervous disorder. The fourth symptom is tabes dorsalis develops. It is a disorder of central nervous system characterized by the inability to coordinate movements with severe pains in legs. General paralysis of the insane may develop. Chronic inflammation of the iris may set which leads to blindness. In this picture, you can see once again the three stages of syphilis which are already discussed. The primary, secondary and the tertiary stage. So the main symptom of primary stage is presence of chancre. Then in secondary stages, you can see the symptoms like rashes on all over the body. Then condylomata in genital areas, sores, etc. In tertiary stage, the bacteria in syphilis attacks almost all body parts, including heart and central nervous system. Congenital syphilis. The first syphilis what we have observed is acquired syphilis, which usually transmitted through sexual contact. Now this syphilis, which is known as congenital syphilis, means this disease occurs in newborn babies, which is passed from infected mother to the baby. Here the fetus or unborn baby contract the disease through placenta from the infected mother. In congenital syphilis, the babies are either born dead, blind, deaf or born with serious handicaps. Diagnosis or how the disease is identified. A blood test of the patient 30 to 60 days after the first infection reveals the presence of bacterium. Wet films are prepared from the exudates or discharges samples and are examined under dark ground microscope. Serological tests such as Wassermann reaction, Cahan's test and VDRL are widely used to diagnose syphilis. Serological test means it is the test in which antigen antibody reactions are involved. Usually blood sample is taken and these tests are conducted. Treatment. Antibiotics are effectively used in treatment of syphilis. As it is a bacterial disease, we can use antibiotics here. Penicillin is extensively used if it is not allergic to the particular patient. So most commonly used antibiotic is penicillin if the patient is not allergic to it. Alternatively, we can use tetracycline, erythromycin, spectinomycin, spiramycin or oleandomycin as the antibiotics. Depending upon the intensity of infection, antibiotics are prescribed for specific period. So, doctors, after seeing the condition of the patient, he prescribes the particular antibiotic for particular days. After the treatment is completed, follow-up examinations of urethral discharges should be made to confirm the absence of the bacteria. So this is very important, follow-up examinations. After treatment, again doctor has to check the urethral discharges to confirm the absence of bacteria. Infected mothers must be treated early to prevent the fetus from contracting the disease. Prevention of syphilis. See, already I have told you the prevention for all the prevention symptoms and mode of infection is almost similar in all sexually transmitted disease. So quickly we'll discuss now prevention of syphilis. Education, what are the important steps? So here I am giving few important steps to prevent the syphilis. Education and counseling to reduce the risk of a sexually transmitted disease acquisition. Promiscuity should be avoided. Sex with a single partner is the best method. Homosexuality and rectal sex should be avoided. Use of condoms during intersexual intercourse. Washing before and after sexual intercourse. Detection of asymptomatic and symptomatic persons. Effective diagnosis and treatment are few steps to prevent the